Hey there! Today we're diving into a topic that, let's face it, affects so many of us as we get older: hormones. They're, absolutely essential for our health, but as we age, our body's production of them naturally starts to slow down. This can lead to some pretty big changes, and that's where something called hormone replacement therapy, or HRT, can come into the picture. So let's get into it.
So, does any of this sound familiar? Maybe you just don't feel quite right anymore. You're fighting with low energy, your sleep is all over the place, or you're dealing with mood swings that just pop up out of nowhere. I want you to know these feelings are super common, but that doesn't mean they're easy. They can make it really hard to just enjoy your life. So, what in the world is HRT anyway? Well, it's a therapy designed specifically for women who are in that perimenopause or menopause stage. The goal is actually pretty straightforward. It's all about helping to balance out those declining hormone levels. And by doing that, the hope is to relieve all those pesky symptoms that come along for the ride. You can almost think of it as a way to help you start loving your life again. Okay, let's kick things off with the number one reason so many women even start looking into HRT. We're talking about what doctors call vasomotor symptoms, but you probably know them as hot flashes and night sweats. Yep, they're the most common and maybe the most infamous complaints of menopause.
And let's be real, they are so much more than just a minor annoyance. Having a hot flash right in the middle of a big work meeting? Ugh. And night sweats, they don't just mess with your sleep. That lack of good rest can create a whole domino effect of other problems the next day. So, the solution? This is where HRT can be a real game changer. It's a proven, effective way to help stop these symptoms, often in their tracks. That means you get better sleep, and it just gets easier to go about your day without those sudden, really uncomfortable interruptions.
All right, let's move on to reason number two. Now, this one isn't as immediately obvious as stopping a hot flash, but wow, is it important for your long-term health? We're talking about strengthening your bones and protecting your health from the inside out. Okay, so here's the deal. There's a really tight link between your estrogen levels and the health of your bones. See, estrogen helps manage the whole process of breaking down old bone and building new bone. When your estrogen levels drop during menopause, that process can get out of whack, and you can start to lose bone faster, which can make them more brittle. This is exactly why HRT might be something you really want to talk to your doctor about, especially if any of this sounds like you. If osteoporosis runs in your family, or if a doctor has already told you that you have low bone density, HRT could be a powerful tool to protect your bones for the long haul. Okay, on to reason number three. And this one, well, it can be a little tough to talk about, but it is so common. It's about a collection of symptoms that doctors call genitourinary syndrome, and it's all about restoring your physical comfort. So, as those hormone levels, especially estrogen and progesterone, start to decline, it can cause things like vaginal dryness, itching, or burning. For a lot of women, this also means pain during sex because of a lack of natural lubrication and just other uncomfortable changes down there. And get this is not some rare fringe issue. Not at all. Experts actually estimate that a whopping 70% of women go through these exact symptoms. But here is the crazy part. Even though it's that common, a tiny fraction of those women actually talk to a doctor about it. We have got to normalize this conversation because there are absolutely solutions out there. And guess what? HRT can be a fantastic solution here. It actually helps your body restore things like collagen and tissue elasticity. Plus, it can bring back that natural lubrication, which directly tackles those uncomfortable and sometimes painful symptoms. Okay. Let's switch gears for a moment and talk about a really specific situation. We're talking about women who go through menopause before they even turn 40. That's called early menopause. This can also happen because of surgery, like having your ovaries removed. This is a whole different ballgame, and it comes with its own unique set of health concerns. And you can see the comparison right here. The estrogen your body makes naturally acts like this amazing protective shield for your heart and your brain. So when you lose that shield years or even decades earlier than nature intended, it can unfortunately raise the risk for some serious conditions like heart disease, Parkinson's, and even dementia. For these women, HRT is often a vital part of protecting their long-term health. So, we've talked about all these potential benefits, but the big question is still on the table. Is HRT right for you? And you know what? It's not just a question of if, but it's also very much a question of when. Yeah, the latest research is really clear on this. Timing is everything.
All the evidence points to the idea that HRT is safest and works best for women who start it either as they're approaching menopause or not too long after it's started. Of course, everyone's body is different, but this timing factor is a huge piece of the puzzle.
And really, this is what I hope you take away from all this. Look, menopause is a totally natural part of life, no doubt about it. But living with symptoms that make you miserable, that does not have to be your reality. You absolutely have options. So where do you go from here? What's the game plan? Well, it starts with just acknowledging what you're feeling. Step 2 is learning about your options, like HRT. And then, the most important part, take that information and start a conversation with your doctor to figure out what's truly right for you.
So we'll just leave you with this one question. Your health and how you feel every single day are so important. Isn't it time you put them right at the top of the list? Thanks for joining us.